The Senate race in Georgia is drawing plenty of national attention. Republican House member Tom Price chose not to run in that race and instead seek re-election for his seat and his role as vice chairman of the House Budget Committee.
Yeah, joining us now in our first on CNBC interview, we welcome Congressman Price, who's live for us from Atlanta. Thank you, Congressman, for joining us today.
Thank you. Wonderful to be with you.
What for you is the overriding issue that's going to bring people to the polls today?
Well, I think it's what they see as dysfunction in Washington right now. They see an administration that's overreaching and doing things without the consent of Congress. They see a United States Senate that is blocking everything that comes from the House. You know, there are 387 pieces of legislation that the House has passed and sit now on Harry Reid's desk, and it's not that he has another idea, it's that he doesn't want anything done and refuses to bring those up. So American people are frustrated with this, and I think they're going to make a very clear statement that they want to turn the Senate in Republican hands so that Article 1 branch, the Congress, can speak with one voice and draw the contrast for the American people with the executive branch.
And, Congressman, we also know it will be the power of the purse. To quote Mitch McConnell, quote, "We own the budget if the GOP takes Congress." So what is your party going to do with the budget?
Well, what we've done the last 4 years in the House of Representatives is to put forward a budget that actually gets to balance within a 10-year period of time, makes it so that we can revitalize this economy, outlines some tax reform proposals that would get this economy rolling again, and addresses the energy issues that you've been talking about to make certain that the United States can indeed become energy independent. That changes the economic equation in a big, big way. In addition to that, we believe that health care, Obamacare, has been incredibly oppressive to large and small businesses trying to create more jobs, trying to expand their businesses, and we believe it's important to put health care decisions back where they ought to be. That's with patients and families and doctors, not with Washington, D.C.
I mean, with all due respect, Congressman, the oil industry in this country is already doing pretty well. You know, the shale, the Bakken up in the northern plains is booming right now, and we are seeing the impact it's having on the price of oil these days. But having said that, do you realistically think that the Keystone Pipeline will finally get the green light if the Republicans take the Senate this time around?
Well, it would get the green light through the United States Congress, through the House and the Senate. Whether or not the president would sign it, that's another question.
Point.
But
do you think that having the Republicans control both parts of Congress would put enough pressure on the administration to finally get the okay for that?
Well, I sure hope so. But we ought to be rejoicing in more energy production in the United States. What we need is to allow for appropriate and responsible exploration, not just on private land, which is where all this is coming from, but on public land as well. And that's what the president has blocked. That's what the administration has blocked. That's what Harry Reid has blocked. That's what the American people want. Energy independence for the United States of America.
Congressman, to quote our next guest, he says if the GOP moves forward the Ryan budget plan, there will be a, quote, huge public backlash with regard to some of the cuts that will be made. He says, quote, unquote, go for it. Are you going to go for it?
Well, the fact of the matter is that there haven't been cuts in the entitlement programs. What there is a saving and a strengthening and a securing of Medicare and Medicaid and Social Security. But all three of those programs are destined to go bankrupt under the Democrats' current proposal, under the current law, which they embrace. So it is irresponsible and reckless for Congress not to address these programs. What we need to do is put in place the reforms that will allow for greater choices within Medicare, greater choices within Social Security, greater choices within the Medicaid program so that states have greater flexibility, so that these programs can actually survive and serve the individuals that they are intended to serve.
Congressman Price, good to see you. Thank you for joining us today, sir.
Thanks so much.
Tom Price.